started. So welcome everybody to the Health Workforce Council quarterly meeting. This is our fourth or fifth meeting, I believe. We launched the Health Workforce Council last June. So yeah, this would be our fifth meeting. So thank you for joining us today. We have an exciting agenda. You can go ahead to the next slide. So we'd like everybody to just introduce yourself through the Zoom chat. We don't have enough time today to do individual introductions, but please, in the chat, let us know your name, your title, the organization you're working with, and if you're participating in any of our current work groups, please identify that. Or if you want to share any interests or projects in health workforce that you're working on, please feel free to indicate that in the chat as well. And while we're doing that, if you go to the next slide, I can go over our agenda today. So we'll start with the introductions through the Zoom chat, and that can continue throughout the presentations. Feel free to use the chat to ask questions and engage in conversation as well. We're going to start with a presentation from HCAI about their Wellness Coach project, and then we're going to have EM Consulting present on their Lay Counselor Academy. And we have HCAP here to present around the services they provide for healthcare apprenticeships. And then I'll be sharing some updates on the Health Workforce Council and our work groups. And we have a few of our work group champions with us today, which is really exciting. So they'll be coming off mute and sharing a little bit about what their work group has been up to. And then we'll just wrap up with some save the dates and our closing. So with that, Ben, if you are ready, we're going to jump right into your presentation, and I'm going to let you introduce yourself and hand it over to you and your team. Thanks.
Yes. Hi, thank you, Haley, and hello, everyone here. I think I recognize a few names, and many of you, I think this is a first-time introduction. So I am Ben Gamache with the Department of Healthcare Access and Information in the Office of Health Workforce Development. And I'm a policy analyst that has been leading the development of the wellness coach profession, which we will talk through today. And I know we have kind of a short timeline here for being able to go through this. So please, I am happy to connect with anybody after this if they would like to discuss, see if there's any potential for collaboration or partnership as we continue to develop out this role and try and implement it in the coming months. So I'll make sure to put in my my email in the chat as well. Okay, go ahead to next slide, or I'm not sure if I have access. Oh, perfect. Okay. So for those of you who aren't familiar, HCAI is a rather new department, and we are tasked with providing access to equitable, affordable, and quality healthcare in a safe environment through a diverse workforce. So that diverse workforce is definitely a key piece there. Next slide. And as part of the 2021-2022 California budget, there was a new initiative, the Children and Youth Behavioral Health Initiative. And as part of that, there was this effort to transform behavioral health specifically for children and youth. And so HCAI received almost $340 million to design and build the wellness coach workforce. It was originally labeled the behavioral health coach workforce, but through stakeholder engagement as well as polling of youth and families, we landed on the term wellness coach. And so we do understand wellness coach exists in other professions and is out there, but we are tasked with really defining what a HCAI certified wellness coach will mean, which I'll talk about in some future slides. So next slide, please. So this wellness coach role is designed to increase overall capacity of the behavioral health workforce. Specifically, as I mentioned, it's also about building a diverse and representative workforce that work in a wide variety of settings. We're looking to fill in some of the workforce gaps that exist today, and I'll touch on that when we get to our training and requirements for certification. We also want this to be a desirable occupation in and of itself, so that individuals can get into the behavioral health workforce and also ideally have enough support that they can support themselves by staying at this level of profession, but also creating stepping stones really an entry point so that individuals can continue on to more advanced behavioral health roles, such as master's levels, licensure, and above. Because this is part of the Children and Youth Behavioral Health Initiative, these individuals are specifically intended to engage directly with youth aged 0 to 25, which is why our settings we're focusing on are primarily the public school system, community-based organizations, but again, they're really intended to be implemented in a wide variety of settings. And then we also want to ensure that we're really recruiting diverse individuals and making sure that they are part of the vulnerable populations where they live, study, and work. So trying to get to our children and youth in the places, again, where they are already involved. Next slide, please. So I realized this is going to be a little bit annoying. You're just going to have to kind of keep clicking through this. There's several of these here. So how the role was developed is we looked at tons and tons of research. We also interviewed over 50 industry partners, and then we went through a process of designing, testing, and then refining our model through stakeholder engagement process to where we got to our final stage, where 2022 was really the development of the model, and now we're in the implementation phase, which we'll talk about in future slides. Great job on those slide clicks. So the behavioral health, this is a representation of the behavioral health career lattice. Again, this is just an illustrative example of how we're trying to fill in some of the workforce gaps that exist today. So if you click on the next slide, you'll see, or I'm sorry, there we go, that our wellness coach nestles in at the associate's level and bachelor's level. So individuals must complete those levels of education in order to be qualified to be a certified wellness coach. And this is also why we are partnering with our community colleges and CSUs to help us build out specific training programs for the wellness coach profession. And again, this is meant to be able to bridge the gaps today because we're looking at programs that already are in existence so that individuals, if they want to continue on to their MSW or to go on to be a PPS credentialed individual, that they have the foundation, they've already been integrated into the education system so that they can continue on into those more advanced professions. And we'll talk about this in future slides, but we are providing funding and resources so that there is support for individuals to enter into these levels of education, because we know that that is a big barrier for many, especially when we think about that diverse workforce. And it's why it's so important for us to work with our community colleges, because they really are really helping to build out that diversity throughout the state of California. So go ahead and next slide, please. So the overview of the Wellness Coach. So prerequisites to enter into this program. For the Wellness Coach 1, near recent or recent high school graduates. This is not, we're not only trying to recruit high school graduates, you just need to have a high school diploma or equivalent in order to be able to enter into the Wellness Coach 1 program. And for Wellness Coach 2, you need to have a Wellness Coach 1 certification or an associate's degree in a related field. The education program is the equivalent of 2 years, so an associate's level for Wellness Coach 1, and an additional 2 years for Wellness Coach 2. And then you'll see that there's rather extensive field experience. And those individuals can get that field experience through a combination of field practicum courses in the degree, as well as once employed. I'll talk about that a little bit as well. Upon completion of their degree, as well as the other requirements, they can submit to be certified as a wellness coach 1 or 2. And the services that these individuals offer are really in the primary prevention and early intervention spaces. So our Wellness Coach 1 is really focusing on wellness promotion and education, life skills, mental health literacy, and then there's going to be some limited individual and group support, really with structured curriculum. And then our Wellness Coach 2 is where they build upon that, and they're going to be stepping more into goal setting, life skills, coping skills, and then more direct experience and more direct one-on-one and small group coaching. And these individuals are meant to operate as part of a care team. Again, we're not trying to supplant any roles. We're just trying to supplement the care teams that are out there and are often overburdened so that we can have another trusted individual support behavioral health for our children and youth. And you can see there's the full list of services, which I'll touch on in the next slide. But we also see that, again, as part of that care team, that our individuals in the school setting will really operate under the direction of and coordination of our PPS credentialed individuals and then licensed professionals outside of school settings. And we really are hoping, again, that as part of these care teams, we can help those individuals operate at the top of their license by helping support our children and youth in some of these early intervention spaces. Next slide, please. So as I mentioned, these are our core services here that we've touched on. And then there's some additional competencies as well that is a big focus for these individuals as part of their training program. And of course, once they're in the workforce, and that cultural competency, humility, responsiveness is a really important aspect of this. Of course, professionalism, ethics, and legal mandates, ensuring that they're apprised of the current laws and ethics. We will be also creating our own code of ethics through HCAI that they would be agreeing to. Communication is a huge component of this. So active listening, empathy, ability to communicate with those that they're working with, and then the ability to adapt and be able to operate in different environments. So create enough of a foundation and a framework that they can be utilized wherever they are most needed. Next slide, please. So this is a representative example, essentially to say that pretty much anybody it can be part of the pipeline. We're looking at those that are already currently working in schools and are working with our children and youth already. Those that are already in the healthcare or behavioral healthcare or health workforce and already have qualifications, and so they potentially can fast track themselves into this certification. Again, it could be those that are just graduating and this is a brand new profession and a brand new entry into the workforce. It could be those that are in unrelated fields and that have a desire to work with in behavioral health and or with youth. And then also really looking at individuals in colleges. So those that are already in social work programs or health and human service programs as already being largely pre-qualified to enter into this certification. So we are really going to be working on a statewide campaign through our marketing efforts to really make this opportunity available to anyone and everyone that has interest. Next slide, please. So this is essentially just a representative example of example sites anywhere and everywhere. Our primary focus, as I mentioned, is going to be schools and community-based organizations, but we're also looking at health centers, government centers. It looks like my formatting got a little off here, but essentially this is to say that we are going to continue to try and make this as statewide as possible, but our primary focus will be those public institutions of schools and community-based organizations. Next slide, please. So a multi-year timeline, where are we right now? We just brought on our marketing vendor. We are actually diving into our discovery sessions and really thinking through our statewide campaign strategy right now. And that is something that, again, because this is a new profession and because wellness coach has been used elsewhere, this is something that we know awareness and that visibility is going to be really key. So also connecting with potential training institutions so they can be well equipped to market this out to their students, continuing to talk with employers so that they're aware of this opportunity, and then just the general public so that children, youth, families, and communities are aware of this new opportunity. Certification is going to be launched early next year. So we, again, as HCAI, are going to be the certification vendor for this, and we are bringing on a third party to help us build out a statewide infrastructure for certification. We also are working right now with, as I mentioned, our CCs and CSUs to develop training programs. And so we're really looking to have our kind of custom wellness coach programs starting in the fall 2024 semester. But we also are looking at those kind of pre-qualified experience tracks as well. So those that already have gone through a lot of these qualifications, how can we get them up and running and certified faster, because we understand the need is now and that there are many that are already pre-qualified. So we're looking through that as well. We are going to have employer support grants so that employers have resources and support to hire on coaches upon certification. That grant process is in the development right now, and that'll cover salaries for coaches, but we're also looking at other aspects like capacity building and even the potential for paid internships. So that's still to be developed, but we are going to have funding, bridge funding available for employers, as well as scholarships and stipends to reduce barriers and encourage individuals to enter into these training programs. So all those are meant to align rather closely. And the long-term goal is sustainability, to make this a reimbursable provider type through Medi-Cal and commercial insurance. And we are working with our partners, the Department of Healthcare Services and the Department of Managed Healthcare, to make this a reality. So long-term goals is, again, by early 2025, to have this be a reimbursable provider, but we will have that employer support grant funding in the interim to bridge that gap. So that is our very high level timeline. And so for everybody here as potential employers, for those that maybe already have people that they think would be qualified for this, we would love to connect with you, chat with you, figure out how, again, we can better support you to help integrate these individuals, because we do have a lot of technical assistance that's needed. We need to make sure that we're connecting with our education community so that they have all the resources and support they need to ideally bring on a wellness coach as somebody that can support their children and youth and then their overall community. So I will make sure to put in my email in the chat. If you go to the next slide, there's also ways to stay updated. So that's our general email, but I'll throw in our email as well as we have now a specific wellness coach email that I'll put in the chat as well. And then if you want to subscribe to our mailing list, that just is general behavioral health workforce updates, but that's a great way to stay apprised of our current efforts that are happening. And then of course, always check out the Children Youth Behavioral Health website. Has a lot of information on the overall initiative. So I hopefully didn't take up too much time. I don't know where my clock is, but thank you so much, Haley, for letting us present today. And again, anybody that has questions or would like to discuss in more detail, please don't hesitate to reach out.
Thank you, Ben. You did great. I noticed you did have a couple extra slides that were, do you want to go over those? You do have time. You have about 8 more minutes.
So those slides in the appendix are very text heavy. I don't know if it makes sense to go through them. I like to present them. Oh yeah, and for some reason my editing got a little off. So maybe I can send you an updated, I'm guessing it's probably a conversion of PowerPoint to Google Slides or something, but I'll send over the PDF so that we can disseminate this out. But I'm sure people are curious of what are the training requirements. So here's an example for Wellness Coach 1. Again, it's really a blend of, again, the focus behavioral health. So we're looking at psychology, social work, counseling frameworks, a lot of the things so these individuals would be ready to enter into the workforce. And then the next slide is more about Wellness Coach 2, which just expands beyond that. And then we have more and more information that just provides additional context into the scope of services that these individuals would do. So this really breaks down what each one of those core services would actually look like for both of these professions. So again, we will provide this. I think it's too much to go through each one of these. Again, these are text heavy. So I think it's helpful to just have them and then you can digest them. And again, I am happy to connect. We are in an effort right now of implementation. So we are in the phase of connect. We would love to do some follow-up conversations with individuals to dive into this in more detail. So that's why I put them in the appendix, because I think it's very helpful once it's sent out, but I don't like to do it in my presentation because I know when I see one of these slides, I'm like, I phase out. But thank you, Haley. That was, again, really, really appreciate you inviting us here today and allowing us to present. And I know that you have a wonderful presentation coming up right after me. I see Dr. Morrison just came on. So I'm super excited for y'all to hear about all their efforts too. They are doing wonderful work as well.
Excellent. Thank you so much. We do have time for questions. If there
Sure.
are any questions from the group, feel free to unmute yourself, or you can drop your question in the chat.
So this is Cal Gordon. I'm pediatrician, deputy health officer for Santa Cruz County, but I'm also on the board with Salud, para la gente. And so if we're interested in actually having these individuals come our way, are they ready, or when will they be ready?
Yeah, great question. The first cohort will be upon certification in early 2024, and those will be those that are in those pre-qualified tracks. So it's really going to be our those that are already working in a similar capacity and already have that AA or BA degree in social work and human services, and then again have experience working with children and youth, those individuals can be fast-tracked into certification and ready to be employed as early as we have that launched. And our target for that is early 2024. And then we're going to continue to see more and more individuals be certified on a rolling basis, especially as we ramp up our customized training programs. So I would say initially, I'm not quite sure we have goals. I'm not quite sure how many people will get certified up front, but 2024 is when we can expect to start having these people enter into the workforce.
Thank you.
You're welcome.
Any other questions for Ben and his team? I'm not seeing any raised hands, at least in my view. Okay, well, with that, we can go on to our next presenter, which Ben already introduced, which is
Yeah,
great.
Didn't mean to take
That
your
was so
intro
awesome.
thunder there.
Thank
I
you,
love
Ben.
the
You like passed the baton.
Yeah. And I actually met, virtually met both Ben and Elizabeth because they were doing presentations at the CPCA Workforce Symposium. And that's when I saw both of you present. And I said, I want to bring this back to Santa Cruz County and share with all of our healthcare organizations. So happy that you guys are here today.
Me too. I feel like it's
yeah.
a little bit like we have a Vegas show, except we switch off who's the opener. So
Right? It's kind of like a reunion.
I love it. Yeah.
So with that, Elizabeth, I think we set it up so you can go ahead and screen share and I'll let you do your full introduction.
Oh, okay, thanks.
Yeah.
I think I was just looking at people's names and just seeing who I knew. I knew some of the HCAI team, which is it's just always inspiring to hear about the work. I mean, the state going this direction, but I wrote in the chat just the amount of work and skill and time that it takes for your team to get this off the ground, and just seeing it is super inspiring. We have the same passion. Everybody on this call I know has the same passion, which is like, how do we help people who are suffering, who can't get care right now? So I wanted to talk a little bit about something that my team and I created as a response to the lack of mental health clinicians and the dramatic increase in mental health needs. And so I'm going to time myself, just like Ben was super efficient, leaving time for people to ask questions. I want to leave time for that as well. And I'll leave the chat open too, just in case like you want to share something and not wait for that. I think the only thing that I'll share about myself that might be relevant is that I'm a psychologist, I'm a licensed clinical social worker, and a master's in addictions counseling. And it's like such alphabet soup. Like I'm not saying that. The only reason I want to share that is I do think it contextualizes what I'm going to share. The fact that the perspective that I come from is as a licensed mental health clinician who still sees patients. So thank you so much to HIP and to Haley for creating this experience today and for working with us and getting us ready for it. So thank you. So of course, I know I don't need to repeat this to any of you. One thing I just want to say is with the what I'm going to talk about today, we're really trying to solve for 4 problems. And I just want to lay out what those are before I talk about what our solution is. And the first one, of course, is the mental health need, which we have not seen any waning in the mental health need, even as the pandemic waned. So we know that mental health need outpaced resources to meet that need before the pandemic. We know that during the pandemic, they shot up in all age groups, in particular in adolescents, really frightening amount. And I just want to acknowledge maybe right now when I say that this isn't about them who have mental health struggles or those adolescents, like many of us on this call, struggled or struggle with mental health concerns. And many of us have kids who struggled during the pandemic or maybe still struggling. So I know sometimes we say patients or clients or people, but I just want to acknowledge it's us too that's caught in this problem. Problem 2, of course, there's a mental health clinician shortage. This was super bad before the pandemic. my behavioral health clinician colleagues and I always say it was bad before. It got much worse during the pandemic. And it's like the only time that behavioral health was on the front page of any newspaper. It's like you'd look at the New York Times and the Washington Post and USA Today or something, and you'd see, like it'd be on the headlines. And that's really uncommon. When we talk about healthcare, you rarely see mental health in the headlines, but this piece really, really made it into, I think, public consciousness, even outside of like folks like us who are working. And of course, perhaps as importantly, problem number 3 is that licensed mental health clinician shortage is made worse by the fact that existing mental health clinicians don't reflect the US. They don't reflect the state, and they often don't reflect the community that they're serving. And I don't mean to make an asterisk out of something so serious, but the reason for that is systemic racism, right? From schooling, through university, through academia, through occupational licensing. I don't know if anybody has followed, the Board of Behavioral Sciences just released data this last year that showed the pass and fail rates for the licensed clinical social worker exam, and an enormous disproportionate number of people who fail that first exam are people of color and people who have English as a second language, whereas white test takers do the very best. And so we just see systemic racism at every level, creating what we have now, which is a mental health clinician workforce that is disproportionately looks like me. And then the fourth problem that we are trying to solve for is something that's it's a little bit more nuanced, and I don't talk about it all the time with people who aren't in the field, but knowing who comes to this HIP meeting, I knew that you'd all understand and know where I'm coming from, which is right now, if you have Medi-Cal, you are receiving a worse quality of mental health care than people who can pay for a private practice clinician. And that is because there is an overuse and there's mandated standardized assessments that are just burying clinicians and patients that have to be done. Even when they don't have to be done, many clinicians grew up thinking the EHR was a clinical tool and are doing assessment after assessment after assessment after assessment on people, which you would not get if you could buy your way out of that. You would get a clinician when you walked in, they'd say, "I'm so glad to see you. Tell me what brought you in." And they would, hopefully, if they're good, listen really closely. That doesn't happen in the Medi-Cal population. The second thing that happens when you or is more apt to happen when you have Medi-Cal is that your licensed therapist may type through your sessions. And that's because there is such an enormous documentation burden. And the county actually just now put it into place simultaneous documentation guidelines. Like they're basically suggesting that everyone do this. It's kind of horrifying in terms of what we know about what works with therapy, to know that the one single superpower that therapists have is deep empathic listening, and knowing that you can't actually type and listen at the same time. And knowing that the research says that even if there's a device next to you, this is true of all of us too, just so you know, as parents, there's research that shows even when we have a phone out, even if that phone is turned over, or even if that computer is put down, that people perceive we're not listening as closely. So it's a huge problem that we have assessment, closed questions, that we have people typing through sessions. And then there's this last piece, which is we have capitalized healthcare, so you have to diagnose to get paid. And so a bunch of time is spent figuring out in the last 2 weeks, what are all the symptoms that this person is having, so that I can make sure to diagnose them, so that I can make sure to bill, because our system's built on that. So as you can see from these 3 things, none of these are necessarily blaming clinicians. It's not necessarily individual clinicians, but working within a system that has increasingly drained the humanity and is crosswise with the evidence base about what works for therapy. So that's really, yes, the mental health need, yes, the mental health clinician shortage, yes, the lack of representation in our licensed clinician workforce to match the community that they're serving. And we have a quality of care problem when Medi-Cal folks are getting behavioral health services. So here's what we did, what my team did. I'm deeply interested in the research about what works. Why does therapy work? Therapy does work. Really super good evidence. It's first line treatment for most mental health conditions. These are the reasons therapy works. So when we look at the research, there is this phenomena called the dodo bird effect, and that's named after Alice in Wonderland, there's a dodo bird that gave everybody the same prize for attendance. What they call the dodo bird effect in the field of psychology is that there is no one theoretical approach or theoretical orientation or counseling strategy that works better than any other. They all work, but they're all equal. And so when people sort of fight around theoretical orientations, it really misses the point. That's the dodo bird effect. What does work? Like, what does make the difference then? If it's not the type of strategy, if it's not the theoretical orientation, then like, what is it that makes therapy effective? This is it. You're looking at it. The majority of research shows that the overwhelming sort of curative factor for therapy is the establishment and maintenance of a skillful therapeutic alliance, which is an empathic relationship with the person that you're working with. Non-judgment, a total 100% lack of judgment, unconditional positive regard, which is thinking about someone positively, seeing their strengths, anti-racist practices, so having a really high awareness of how to correct for biases so that we are not providing poor care to people of color and other people who have historically been discriminated against, and then strength-based, which kind of flies in the face of having to diagnose to get paid. There's no license that is needed to practice these things legally, ethically, morally, spiritually. You don't need a license to practice what are the most powerful and effective factors in therapy. Evidence-based practice, sorry to use an acronym. I know we have so many of them, and I was just banking on that people would have a sense of this, but evidence-based practices. So we have a lot of research on evidence-based practices. Like I said, there is a dodo bird effect. So there's, any number of evidence-based practices. But here are some of them, and I think probably everybody here knows and probably have been trained in, and at your organization, probably everybody's trained in these things. Tons and tons and tons of evidence behind all of them. And deep reflective listening is actually all by itself an evidence-based practice, meaning it results in improved health outcomes for folks. And you don't have to have a license to do all of these things legally. I mean, we all, medical assistants get trained in motivational interviewing, nurses get trained in CBT, all of our staff gets trained in trauma-informed care practices, CHWs get trained in person-centered counseling strategies. Hopefully all of us in the helping professions have training and skills in deep reflective listening. These are not, you do not have to be a psychologist or an LCSW or an LMFT to do these things. We train people to do these things all the time. So between this, if we look at this, and knowing that you don't have a license to do these things, what we've done is pulled all these things together and said, this is mental health counseling. Even in terms of what I do as a licensed person who's seen patients for 30 years, what's on the last slide and this slide represent 80% of what I do with patients. And that's true of most therapists. So if we don't need a license to do it, well, let's start training other people to do it. So we created the Lay Counselor Academy, and I created it for my own team initially. So I had about 5 licensed people on my team. I had about 5 people who didn't have any behavioral health degrees or licenses. So I had someone who was in acupuncture school. I had someone who was a Pilates instructor. I had someone who had a bachelor's degree in politics, who I'll talk about a little bit more later. And what I did is I created a crash course for the people on my team that didn't have the degrees or licenses in everything that you saw on those 2 slides. Now, these people were really, really skilled to start with. They had great emotional intelligence. They had great insight. They were super self-reflective. They'd done a bunch of their own work. So you can't just take anybody and train them and make them into effective mental health counselor. But we trained these folks to do mental health counseling. So what we call it is lay counseling, and that's just after the term like layman, or I'm from Alaska, lay midwives who don't go to nursing school. They don't even have to have a high school diploma, and they learn to do midwifery from other midwives. My daughter was delivered by a lay midwife. A lay counselor is somebody who is doing mental health counseling and did not come through traditional pathways of schooling or licensure. And, when Ben was talking about the wellness coach, all of these things I think are both, and there's nothing about what approaches, there's nothing about what I'm going to talk about today that excludes any other efforts to expand the behavioral health workforce. I feel like we are all working toward the same goal. I just want to make a distinction, which is peer support, mental health educators, and wellness coaches. Right now, mental health counseling is not in their scope. Right? Part of that is you refer to somebody else, you refer to a licensed clinician to do those things. And so I just want to be really clear that lay counselors provide mental health counseling. We have a course that is 65 hours long, which I know probably sounds kind of crazy. It seemed kind of crazy to us. How could you possibly do a crash course in graduate school in 65 hours? And the answer is, well, you can't. Of course, you have to start with people who are super skilled. And if I asked all of you, if I said to you, name 5 people at your organization that are not in your behavioral health department that are just amazing, they would be such good counselors, you'd know who they were. You'd pick the people that patients always talk to anyway. You'd pick the people that have a lot of humility and are really open to feedback, who have great interpersonal skills and super good insight. You'd know who they were. That's what we tell organizations, and that's who they send to the Lay Counselor Academy. So we are on our 6th Lay Counselor Academy. So far, we've graduated 130 people who have gone through this course, this sort of crash course. So that's me down on the right with my daughter, and up on the left with the sunglasses, or the one on the top, her name is Allie. And she is the one who has a bachelor's degree in politics. We are the co-creators of the Lay Counselor Academy. She is the lay counselor. So we always say I'm alphabet soup with all the letters. And Allie always says that she's bone broth, which is not totally true since she has a BA, but you know what I mean. And I think what's been interesting in this journey that we're on, that I'm not surprised about, because lay counseling exists in South Africa and in India and in Ghana and in Ecuador and many, many lower income countries have been doing training and using lay counselors for decades. There's a ton of research that shows that you have the same outcomes that you do with a licensed therapist. And so I'm not the first person to find this out. And I want to let you all know that we get data back on our team, my own team, all the time. And what we see is that the lay counselors have the same health outcomes with patients as the licensed folks have, just like it's been shown in lower income countries. So this is an example of my own team's data. We provide direct services and we survey our clients every 6 months. And this is our most recent data that we got back. And you can see that the changes or differences are just absolutely minuscule between licensed therapists and lay counselors. So I want to stop and give time for people to ask questions or hear reactions. I did send a few things to Haley to make available afterwards that give sort of more information about this. But I wanted, just in case, that this is my email, and there's information about the Lay Counselor Academy on my website too. And I'm totally open to disagreements. This is kind of a radical idea. And if people are like, what are you doing? That's okay too, to say. It's an important dialogue.
Thank you, Elizabeth, for that presentation. And we do have about 5 minutes for discussion or questions. So feel free to unmute yourself if you have a question or comment for Elizabeth. It's a quiet group
Stephanie.
today.
Sorry, I just saw Stephanie. Hi, Stephanie. I know I'd love to hear from at least one of you because I hope it wasn't like a conversation stopper.
There have been some comments in the chat too.
Oh,
There's some
thank you.
positive feedback coming to you through the chat as well. Sorry, Stephanie, go ahead.
Yeah.
Hi, no, I was going to say, so Janice has had a few of our peer supports participate in Elizabeth's Lay Counselor Academy, and it's fantastic. It's a really great support for their certification track and their client skills and support on the unit. We have peer supports in our residential setting and in our outpatient programs. And, you know, I've said it's just been really positive feedback for them and from the staff that they work with, who the peer supports support not only clients, but the other staff directly related in client care. So yeah, I mean, I think that, you know, for us, it's really a bandwidth of, we love every person. We love our SUD counselors to participate as a lay counselor because it's a very different learning track. And really for us, it's just capacity around how do we serve the clients and yet still reserve time for people to participate in the training because we found it really valuable. And yeah, I mean, I'd like to go, but then I couldn't be in these meetings and then that would be sad. So,
Stephanie, thank you so much for saying that. We love your people. And I want to just highlight something that you said, Stephanie, that I think is important. And I'll just share this slide really quick, which is what we notice about organizations who send people to the Lay Counselor Academy is there's really all two paths. One path over here is a lot of times organizations send case managers, SUD counselors, outreach workers, CHWs, ECM counselors, and they're not going to change their job to become a mental health counselor, but they're going to continue to do their job with significantly enhanced mental health counseling skills. And that means that they may not, their patients may not need to be referred to the 2-month wait list for the licensed person. We do see a lot of SUD counselors. I'm an SUD counselor because as mental health counseling isn't in the SUD scope. They don't learn that, even though the skills overlap. Addictions counseling is so complex and demands such skill that it's kind of ridiculous that mental health counseling isn't wrapped into that either. So we do see a lot of SUD counselors who add that to their skill set so that when their patient says they have a panic attack, they don't have to put their patient on the 3-month wait list for the licensed person. They can also help with that. But there is another pathway, which is some organizations are sending case managers, putting them in the behavioral health department, giving them a licensed supervisor to provide weekly clinical supervision, and then backfilling that case management position. So sort of two paths that we're seeing.
Mm-hmm. Elizabeth, we have a few questions in the chat. One is this a reimbursable role? And what is the cost to attend the academy? And I if you said this, I apologize, I didn't catch it, but I'm assuming it's a virtual academy. So they would be accessible to people to attend regardless of where they're located.
Yeah, those are all super good questions. So is it a reimbursable role? No. And I think the power of what the state is doing and what Ben is sharing about is really, it marks a massive system change to have this provider type billable. That is not the case with lay counselors. And in fact, most of the organizations that have sent people thus far, and we've had people from the East Coast, have been large health systems that are unable to meet the needs of their folks, and they're willing to take the cost of not just training the lay counselor, but putting them out for services. But the other thing that we're looking at is value-based payment. So many of the FQs who have sent folks to us or the other community behavioral health organizations have some value-based payment in which this fits in. And the last thing that I would say about funding it is just like Stephanie said, some folks are sending people who are already paid for in their organization. They're already working there, and we're adding these additional skills to them. So there is the cost of the academy, but it's not important whether they're reimbursed or not, because these are already providers who are in the organization and paid for. So the cost varies between $5,200 a person down to $3,800 a person. And that variation is how many people are sent. So some organizations send like 20 people, and so they pay the lowest cost per person. I will say that, and there's people, here who know this, that we always have free slots that we reserve for people. So if you're interested and you have no budget for it, please reach out to me, because every single Lake Counselor Academy we've had has free spots in it. And then to your question, Haley, the first session is in person. And the reason for that is because it mirrors the counseling relationship in terms of there is no real learning, development, or transformative change unless the relationship is empathic and trusting. And so we bring everyone together, we take them out for dinner the night before, the next morning we spend a bunch of time practicing and counseling on each other and having fun. So we really connect. And then everything after that is online.
Excellent. I want to be mindful of time because we do have one other presenter who I know has to jump in the car and get on an airplane immediately after her presentation. So feel free to continue the conversation and questions via the chat. I know I have a couple of questions for you too, Elizabeth.
I will.
But with that, I would like to introduce Joy Jamerson, who is with HCAP. And Joy, I will let you kind of do your own formal introduction to who you are and hand it over to you now. So thank you for being with us today.
Well, when I joined, I was you, Haley. So
everybody wants to be me.
Good afternoon, everyone. My name is Joy Jamerson. I am the program manager of outreach here at HCAP, which is the Healthcare Career Advancement Program. And I'll get into more of who we are as an organization and what we do. I'll start my presentation right now. So we're going to discuss using registered apprenticeships as a workforce solution. And I'm glad that the two presenters went before me because this model can be utilized into your programs or into your grant programs. And there are grants to help you with registered apprenticeships and funding. And we'll talk about that in a later slide. Next slide, please. So registered apprenticeships defined is a proven model that actually works. It takes the educational component and on-the-job training and combine both of the two. If you heard from our first presenter, it's kind of hard to find qualified individuals because everyone is searching in that same talent pipeline. There is no more human and human resources. So it's all AI. So if you put in a resume, you probably get an email 5 minutes later saying, thank you, but we chosen to go a different route, even though you may be qualified for the position. So a registered apprenticeship actually is a high quality career pathway for those individuals that may not have been able to get into that career field because of one, probably lack of resources, lack of funds to go into college, and lack of information. Next slide, please. So who is HCAP? We're a labor management organization, and please do not let that scare you. We promote innovative and quality in healthcare career education. Under the HCAP umbrella, we have different departments, and registered apprenticeships is one of them. We can work with both union and non-union employers. We're also a U.S. Department of Labor intermediary, which means we can provide free technical assistance to help you figure out what is registered apprenticeships, the occupations that may be a good fit for your organization, and then helping you submit to the state for approval and probably providing you funding. And also we're an apprenticeship ambassador. So we are leading the way to promote more registered apprenticeship opportunities, especially in healthcare, because when you hear registered apprenticeships, a lot of people hear construction and trades and not healthcare or IT or logistics and transportation. And we're also a recipient of the H-1B skills training grant and the Closing the Skills Gap grant. Next slide. So we work all over the US, as Haley said. As soon as I finish this presentation and we log off, I'm headed to Mississippi to do this same presentation to talk to healthcare facilities, long-term care facilities, you name it, nonprofit organizations, schools, about the joy of building a registered apprenticeship and the pathway that it can help build the community. We all know that COVID is still in existence, and we saw that the whole world shut down, and healthcare took a huge, huge hit. I mean, every industry took a huge hit, but every day nurses are leaving, doctors are leaving, and we need to fill those critical positions to continue our healthcare. So we're all over the US helping build and promote registered apprenticeships in the healthcare industries. And if you follow me on LinkedIn, they do exist in healthcare. Next slide. So what is apprenticeship? Is on-the-job training plus the classroom training. So you can build a registered apprenticeship. The employer has the flexibility to model it the way they want it. We build the work processes based on your job descriptions. The educational component can be online, it can be hybrid, it can be in person. It's customizable. So we take your needs, we listen to your needs, and then build a plan on how you can build a registered apprenticeship that support the needs that you need, the occupation that you need in your organization. Some people can actually take current college graduates or past college graduates and use credit for prior learning for the educational piece and just provide the on-the-job training. So there are different ways to help you build your registered apprenticeship. You just don't have to start, someone don't have to start from scratch. They can actually have a college degree, and if they meet the requirements for the educational component, then they'll be able to receive that credit for prior learning and go straight into the on-the-job training. So it's an earn while you learn model. So these individuals are not just interns. It's not an externship. They are starting their careers, and we also promote that apprentices should start getting paid on day one, but it's all up to the employer. You can wait until they've actually finished all of the educational component and then start paying them for the on-the-job training piece, or pay them while they're in school. Some positions are highly regulated occupations, and we help you with that regulation as well. We have someone on our team that worked with the Montana medical healthcare regulations, and she's a professional in that. So I like to have her on those calls for those highly regulated occupations that we'll be able to, one, talk to the accrediting body, talking to the national credentialing body to let them know that registered apprenticeship is not trying to disrespect the occupation. It's just trying to promote and train more individuals, especially individuals from those diverse populations, into those occupations. Next slide. So how it works, if you're interested, we will explore the benefits of the apprenticeship program, explore the occupations you may be interested. Then we will help build. We will be talking to the state with us. So you'll be talking to the state with us. There's no fear. We'll be able to talk the language that the state is talking. And then California is kind of different. What we consider HCAI, which is state apprenticeship agencies, and then OA, which is Office of Apprenticeships. California is very unique. They have both. So depending on where you fall at in California, we'll either be dealing with the HCAI or the OA. And then we help you partner with different workforce organizations, educational providers, you name it, we'll be able to help guide you throughout the entire process. Next slide. From there, we will help you register your program. And then once you receive that official registration and approval, then you'll be able to launch your program. And when you launch the program, that opens opportunities for additional funding to help you pay for this program. This program is free for apprentices, for those who sign up, but there's funds to help you help your apprentices. So those funds can help pay for the educational training. Some of the funds can help pay for the wages up to 50%. Some states do. Some of it can help pay for any instruments that's needed, any materials that's needed for that apprentice to be successful. Those funds will be able to cover. Next slide. So there are different roles for a registered apprenticeship program. There is the sponsor, who's the administrator, and that's the holder of the registered apprenticeship program. So they'll be responsible for submitting documentation, doing the audits when the state calls and want information about the registered apprenticeship team. They'll be able to apply for the grants or any funding that's available. And then they'll be able to, they're the collector of all of the documentation. The sponsor can also be the related technical instruction provider, which is the educational, it's a fancy word for educational provider. And it also can be the employer. Then you have the related technical instruction provider, which is the educational piece. They're the ones providing the didactic training, and they can also be the sponsor or the employer. And then you have the employer who employs the apprentices, who provides all the on-the-job training, and they also can be either the sponsor or the related technical. So if you're one hospital, you can be all three because you may have the training there. But if not, we'll have to bring in an educational provider to provide the related technical instruction. And you need 144 hours of the educational component for the registered apprenticeship program. And then you need 2,000 hours. There's a minimum of 2,000 hours of on-the-job training to successfully complete the registered apprenticeship program. Next slide. So there, like I said, there's the state roles, there's the state apprenticeship agency, and then there's the Office of Apprenticeship. Basically, SAA it's governed by the state, their state employees and their state administrators on behalf of the Department of Labor. And then the Office of Apprenticeship is where the federal Department of Labor staff does all of the registered apprenticeship in that prospective state. Next slide. So the core components of the registered apprenticeship program, it is paid employment. It is getting those individuals into that position and you're paying them while they're learning the didactic and doing the on-the-job training. A lot of the hospitals or employers don't like the word registered apprenticeship because they relate it to construction and trade. So they'll use work-based learning. And it's a minimum of 2,000 hours structured, and then they have a mentor. So the minimum is 2,000, but if the occupation qualifies for more, then it all depends on how many additional hours the employer would like for that individual to go through the on-the-job training. And then there's classroom learning, which is the 144 hours. That's just course hours. If someone did 60 hours of college credit, we can convert that into course hours and try to provide them with credit for prior learning for those hours. It can be parallel where individuals are going to school 2 days out the week and then doing on-the-job training 3 days out the week. It can all be front-loaded where all of the individuals or the apprentices are going to school first and then going to the OJT, or it can be in segmented options where 4 hours of the day they're going to school and then the additional 4 hours they're doing the OJT. And we'll discuss all of this when we're in the explore phase of the registered apprenticeship to see which one best fits in the organization. Next slide. From there, one of the most important pieces of a registered apprenticeship is the mentorship piece. This person is someone that is already in the position that's been doing the job for a year or 20 years, and they're going to help this apprentice matriculate throughout the on-the-job training piece. I like to say, us as managers, we don't see everyone that goes through day by day. But that mentor does. That mentor will be with that person every day of the apprenticeship. And it can be multiple people. It don't have to be the same. But that mentor will be able to help that apprentice matriculate throughout the program and let you know if problems arise and let you know if there's childcare issues, transportation issues, where someone is not just quitting because they're into got their back against the wall. We'll be able to assist them with either supportive services funding, WIOA funding, or any wraparound services. And then after the end of the program, which lasts about a year, depending on the occupation, individuals or apprentices will receive a national certification that's portable, and they can take that with throughout the US. And that's separate from any required state or industry credential. Next slide, please. So it also promotes diversity. It opens that pipeline for individuals that probably wouldn't have thought about entering into that career field because of one, funding. It helps those individuals get into that, and then it also provides that safety and quality that you're getting a highly trained, you're training someone and they're going to provide, you're providing a safe and quality for those apprentices. And that's why the mentor piece is very important. And here at HCAP, we do provide, promote and provide a free mentor training for individuals that we help build registered apprenticeships for. Next slide. So the benefits of a registered apprenticeships are why a registered apprenticeship program. When I graduated high school, my folks, my parents, they were both saying, go to school, go to college, get a college degree, and live the American dream. I'm proud to say that I did that. I don't know if I'm living the American dream because I'm in debt from getting those 2 college degrees. But that it creates a pipeline for more women of color, more immigrants, and experienced low-wage workers into a more accessible advancement program or career pathways. You may have individuals at your organizations right now that don't want to continue to be a CNA or don't want to continue to be a janitor, and you providing a career pathway to get them into the career that they've dreamed of is very beneficial. It builds internal capacity. It allows for non-traditional approaches. I hear a lot, I meet with a lot of employers on a daily basis, and employers, they're suffering right now, especially in healthcare, and they don't have time to wait on someone to complete 4 years and then an externship, and then they come to them unqualified or unexperienced. So this program will actually, the registered apprenticeship program actually helps the employer build their own talented, skilled workforce. It reduces turnover and related costs. Employers, that's the first question they ask me, well, Joy, what is my return on investment? What is in it for me? And I always tell them, well, if 5 people left your organization right now, how much will you have to spend on recruitment to bring those 5 experienced people to fill those positions? And then we do the math, and it's not good at all. It's high. So it reduces that turnover and related costs. It benefits both the employer, the community, the patients, and the workers. And then it increases access to federal, state, and local workforce resources and funding. Next slide, please. And I'm gonna try to go fast because I got 4 minutes. So it benefits, the benefits for employers, you're building your own skilled workforce, it reduces turnover, and it's customizable to you. Next slide. And benefits for apprentices, they get hands-on training and education, long-term career and greater potential, little to no debt for education, and then they get the national credential on top of the industry credential after they complete the program. Next slide. So sources of funding in California, there's tons of funds for registered apprenticeship programs, especially in healthcare. We're an industry intermediary. You can request funds from us, from your workforce development boards, foundations, and veterans can use their GI Bill for this registered apprenticeship program. And then HRSA just put out 2 grants. I follow the grants like I follow the money. So HRSA just put out 2 grants that's focusing on behavioral health and maternal technician, and I'll put those in the chat. Next slide. So how can we help as an intermediary? We provide free technical assistance. We work with your SAA or OA. We help develop the on-the-job training. We partner you with post-secondary institutions that which you may need. We help you partner with your local workforce boards, help you with strategies on recruitment, and we provide incentive funding. Next slide. So for more information, I know I went through this and it's a lot of information, but for more information, you can contact me. We'll meet and discuss on developing your registered apprenticeship program. We'll begin drafting. And once your standards are approved, we'll be able to submit them. And then once approved, you'll be able to start recruiting for your apprentices. And the next slide is all of my contact picture with my beautiful picture on there. So if you want more information or want me to present in a slower pace, I will be more than happy to send you more information. That's my email and my cell phone number.
Thank you, Joy. That was a lot of information. I feel like no matter how much I learn about registered apprenticeships, I'm always like, what is it again? Like, how does it work again? So I appreciate you giving us all of that information.
No problem.
Yeah, we have time for a few questions, and I actually have one. I'm going to start. I noticed that, as you mentioned, HRSA, and HRSA has funding, and HIP in the past has applied for HRSA funding, but it was an extremely laborious process that required us to hire a grant consultant. Does HCAP provide any assistance with like doing a HRSA application or funding to hire a grant consultant to then do that application? It's so extensive. I'm like, it scares me to think about trying to apply for another HRSA grant.
I wish we did, but with my background, I have 18 years of higher ed administration and workforce development. By me being on the team, I've written grants before. So if you need help with the grant application, I'll be able to provide that that assistance. Sometimes the DOL does it for free, help you with the application for free. But if not, I can probably recommend you to a consultant. But we don't pay for the consultant. We can't pay for the consultant. I wish we could.
Yeah. Okay, great. Thank you. Any other questions for Joy? Or feel free to drop them in the chat. I know Joy does have to probably jump off this meeting fairly quickly because she is traveling today. But if there's any other questions now, anybody?
And I will say this, a lot of people ask me what's the difference between internships and externships and registered apprenticeships. An internship is temporary. It's 4 to 6 weeks or even 4 to 6 months or a year. And then sometimes the internships are unpaid. With a registered apprenticeship, that individual is actually getting hired and getting that on the job training, along with that didactic training. You have different learners. You have learners that can just learn from a book and then they'll be good. And then you have individuals that learn by doing the job itself. And with so many positions in the healthcare sector, it's needed. So this has helped employers build their workforce even stronger with those employers that has implemented it successfully.
Great, thank you for that clarification. All right, well, I think we will move on to our last section of our meeting today, which is our Health Workforce Council updates. As you all know, this is a quarterly meeting, so we try to provide updates as to what our work groups have been doing in the last quarter. So you can go ahead to the next slide. I don't know a lot about Henry Ford, but I found this quote that I thought felt really applicable to our Health Workforce Council. Coming together is a beginning, keeping together is progress, and working together is success. And I feel like that shapes up how it's been for us this last year. As I mentioned at the beginning of the meeting, we launched the Health Workforce Council last June and had our first quarterly meeting. So we've now got a full year under our belts, and I feel like we're now working together successfully. And so I'm excited to share what our work groups have been up to. And we have a couple of our work group champions on the call. So as we come, you can go to the next slide. As we come to their topics or their work groups, I'll let them speak up and share as well. So the behavioral health work group is currently, we're in the process of combining it with the Integrated Behavioral Health Action Coalition quarterly meetings. And so the idea is that we don't want to duplicate efforts, and we want to increase participation by combining with this already established group that meets quarterly and combining our behavioral health work group. So we would have everybody invited to the quarterly meetings, and then we'd have alternative meetings on the alternative months that IBHAC is not meeting, inviting those participants to join us. So we're trying to have strength in numbers to generate more momentum in the projects that we're working on around behavioral health. I think the presentations today are also going to really inspire some of the work that we'll be focusing on in the upcoming year. The other big update is we have been in partnership with Motivo, which is an online supervision platform, and they are offering our region a discount for associate level supervision. And they just recently confirmed that they are willing to move forward with us and honor that discount. So we have organizations that have already expressed their interest, but we can still gather more. It's not like a shut door or anything. So if you are interested in learning more about this, I'll drop my email in the chat. And Suzette, who's on this call as well, is a good resource to chat with about Motivo. And if you're interested, you can still learn more and sign up with us. With that, I think, Adrian, are you still on the call? I'm going to let you talk about the community health worker work group.
Hi, everyone. Adrienne Saxton here. I'm in Berkeley right now, sitting outside a cafe. So apologize for any background noise. Can you hear me okay?
Yes, we can hear you.
Okay. So our community health worker work group is looking for a new name because, well, I just did the same thing. So there's something about work group that we're not loving. And also we want to be more inclusive. So we're looking to changing that name, and we'll be talking with our committee, our work group tomorrow to kind of finalize what some ideas might be. So we're really interested in making sure that folks in our community understand the CHW employment opportunities, training opportunities that are available in our region. And so that's something that we've been really looking at doing and finding ways to get more people interested in becoming CHWs. So we're, very interested in tabling events, coming to spaces where employees might be interested in in the CHW certification or this type of position. So please, reach out to Haley and she can add you to our outreach opportunities document. And then, Cabrillo College did get us a planning grant for developing apprenticeships for CHWs. And we're really interested in partnering with anyone regarding that amazing opportunity. And of course, you all just heard so much about the value of apprenticeships. And so here's a chance, here's an opportunity to get on board with community health worker apprenticeship programming. I think that's it, Haley, unless there's something else.
Hey, yeah, we're just sharing some highlights. Our work groups are doing so much, but we're trying to highlight some of the major projects that we've been able to accomplish in the last quarter. So thanks, Adrian. So our medical assistant work group recently advised the California Workforce Association on their, this is their title, not mine, their medical assistant articulating career pathway. That resource is available on our website. I'll drop the link in the chat to our website. And there's actually a lot of resources available on our website. We've created a medical assistant externship best practices guide for employers that has a wealth of information about setting up your medical assistant externships. We created just going back a moment to the community health workers, we created a community health worker resource guide and community health worker flyers that help explain what the career is, and they're intended to help get more prospective people interested in becoming community health workers, and those are in English and in Spanish. That's also on our website. And then additionally, our medical assistant work group is also interested in exploring an apprenticeship in medical assisting, and that same grant that the community health worker apprenticeship that Cabrillo College was awarded is still available. And so we, our medical assistant work group is going to support an application to do the same grant for medical assisting apprenticeship. With that, I think April, are you on the line with us?
I'm here. Can you hear me okay?
Yes.
So I'm April Lofranco. I am a nurse at Dominican Hospital, and I'm also an adjunct faculty at Cabrillo College. And I've had the pleasure to hold one of the chair positions for the nurse work group over the last year. it's been an interesting journey to try to figure out kind of what our goals of this group are. Of course, initially we were talking about workforce development and how to feed the pipeline of nurses through conversations with education, through Cabrillo College and whatnot. But in discussions, we kept looping back to the need for the retention of the nurses that we currently have in all of the entities around the county. So making our way through the pandemic, of course, has made it that it's a little bit more difficult to thrive in such a hefty environment such as nursing. So a couple of things that we've managed to pull together with the assistance of HIP and some funding that was provided to us from Kaiser was the 1440 Multiversity Healing, our Healthcare's Hero Retreat. They have graciously allowed a handful of nurses. I think we've got up to 50 nurses that are being invited to attend a retreat coming up in August. And there's going to be a number of guest speakers. And, the goal of this 1440 retreat is to fill our toolboxes with more tools that will enable us to be able to continue in this amazing field of nursing moving forward for a career's worth in this field without having to turn our backs into different careers. So I'm hoping to keep the depth of knowledge that we have in our nurses currently to be able to train up the new ones too. And then something that we were able to complete, Anna Sutton has been a great spearhead on the Nurse Week public proclamation to the County Board of Supervisors. This May, we were able to speak on behalf of nurses at the Board of Supervisors meeting, and it was a very proud moment for us to be able to, feel supported by our leadership and read off the well put together proclamation. Just saying how much nurses do support the county, and again, it was a really proud moment for me to be able to experience that. So this work group's been really great, and I'm happy to be part of it.
Thank you, April. We really appreciate you leading us for the last year. And Adrian too, thanks. And Ashlyn, who's on the call as well, she's on mute, but she's our medical assistant work group champion. And last but not least, I will pass it over to Dr. Gordon, who is our champion for, we still don't really know what our name is officially, but part of our pediatric health work group is meeting monthly to focus on pediatrician and family medicine physicians.
Hi, everyone. Cal Gordon. So I am a pediatrician. Also want to recognize Grant Hartzog, who's professor at UC Santa Cruz, who's been part of the work group and has been a leader for the last 15 to 20 years and really working to get UC Santa Cruz undergrad and now postgrad students into medical school, as well as have clinical experiences in our community and working with some of our physicians and the medical society on that. So we started our whole journey in January. We were the last to be launched. We have, after behavioral health, I think the highest acuity shortage for people taking care of, professionals taking care of our pediatric population. And we started as just looking pediatric, but we're talking physicians and nurse practitioners. But we have a fairly large group of family physicians, as well as nurse practitioners that care for our pediatric population. And so they are also well represented. And we have a number of excellent programs that we have highlighted. We actually presented to our HIP Council this month, and as well as our clinicians resource call to sort of broaden the message. And our goal was to identify what the shortage is. We have on the order of like 35, 37 physicians shortage for our county combined with Monterey. Also, what's out there in terms of activities. There's a lot of bright spots that are taking place, which includes family medicine residency program that will be starting in 1 year, which is next summer, which is extremely exciting, between Dignity and Morehouse College of Medicine. That's really based on equity and making sure that we have the physicians that are versed to that and are passionate about that. And this will be, I think, an excellent source of additional primary care physicians to our county. And so we completed sort of our initial task and are looking now at what are the next steps, where are the gaps, how do we integrate this work, so that, and one of our work efforts is working with the County Office of Education to make sure that that on the medical field, there's a clear kind of journey that can be identified, not just physicians, but all the way through in this continuum that this effort represents, that students can go to an online application that really identifies how they get from where they are to that part. So so more to come, and it's been a great progress. It's been great to identify all the activities that are actually in place currently.
Great, thank you. You can go ahead to the next slide. So the last workforce track that we were tasked with to work on over the last year is surgical technician. And as many of you know, we don't have a current local training program for surgical technicians. So we've been exploring different types of partnerships or ways that we can bring a surgical technician training program to Santa Cruz County. And you can go to the next slide. So we're having conversations with an organization called Futuro Health. It's a nonprofit that's working to grow allied healthcare workers across California. And they currently provide a training program for sterile processing technicians, which is it's a career pathway into surgical technicians. And they are launching their own program this fall, anticipated this fall, in surgical technician. And so they're seeking local employers to engage with them on clinical placements. So they provide all of the training piece, and then they work with a local organization on placing students in their technical, or their clinicals. And one of the really unique things about Futuro Health courses is that every student is required to first take a human touch healthcare course that helps them develop essential interpersonal skills. And we've done a couple information sessions and strategic mapping sessions with local employers. And this human touch healthcare course is exactly what employers are saying they value. It's a competency that has been lacking in other training programs that they've worked with across the state. And so they're really excited about this aspect of the Futuro Health's program. So the main, I guess the main message here is that there's more to come, and HIP is going to be hosting an information session once Futuro Health is ready to fully launch their surgical technician program. And so we hope that that will happen this summer. We'll be hosting more information, inviting them to present. And if you're at all interested in engaging in this pipeline, please feel free to email me, and I will get you connected to the group of people who are working on this. We've had a really good engagement with Sutter Maternity and Surgery Center, and we're looking for more employers who want to participate with us in this exciting project. You can go to the next slide. Okay, so last but not least, I am thrilled to share, as of this morning, our contract with the California Workforce Development Board is completed. So we are for sure have the green light. We're going to move forward with the work that the Health Workforce Council is doing for the next 3 years. So huge thank you to Santa Cruz County Workforce Development Board for funding us the last 2 years. And we've looked for a way to get some sustainable funding so we can continue this work. So that email came through my inbox, I think at like 10:30 this morning, right before this meeting. And I was super excited to quickly add this slide in here and share it. We've got the green light, we're moving forward. So this work, we wouldn't really have this grant if it wasn't for all of the work group participants and our champions and everyone who has volunteered their time and energy over this last year. That helped us make this grant amazing, because we could show so much partnership and collaboration happening across our county. And so it really is like you guys who made this grant possible. So with that, I will wrap up. We only have 2 minutes left, and I just want to share, we already have our dates set for our next 2 Health Workforce Council quarterly meetings. We're going to move them to the beginning of the month instead of the end of the month, as we're just noticing people get bogged down with a lot of meetings in the 3rd and 4th week. So they'll be September 6th and December 6th, same time frame, and they'll be online. If you did not receive a calendar invite to those meetings, please email Maria. Her email is here, and we'll drop it in the chat as well. And she can add you to that calendar invite. We're no longer going to be doing Zoom registration. We'll just start sending out calendar invites to people, and hopefully that will help get it on everyone's calendars. And all of our previous meetings have been recorded, and they are on our website. So if you ever want to go back and review content from previous meetings, that's all accessible to you. Our September meeting, we'll be sharing our 2023 workforce report and recommendations from the Health Workforce Council. The Santa Cruz County Workforce Development Board is going to present on WIOA funding for training and services for healthcare organizations, for example, to fund training to upskill their incumbent workers. So the lay counselor thing came to mind for me. I'm going to investigate that more and see if that's something WIOA could fund. And then we'll also be covering some of the aspects of the High Road Training Partnership Grant at our September meeting. So with that, last slide, just wanted to say thank you all for participating, ending right on time. Feel free to email me if you have any questions, and please do visit our website. And I think I'll stop there.